Hey everybody, Jazzmyn Banks following up on my joint replacement video. I talked about a number of things to do with joint replacements and the stuff they don't tell you, and one of the subjects was scar tissue that can build up post-surgically and cause you a lot of problems. So I figured, let my pain and suffering be your prevention. And I got a question from somebody asking, well, what if you have too much scar tissue and now they're talking about surgery to remove it? Is there another way to remove the scar tissue or get the motion back in whichever the joint is? Okay, well, been through that. In my case, I let it go too far. Mostly because, again, I was much younger. I wasn't asking the questions I needed to ask, and they weren't telling me the things I needed to know. But you can use scar tissue massage and tissue lengthening. That you have to find out that your massage therapist is skilled and knowledgeable in this to help with that. Because, again, the key is breaking up those fibers. Preventing them from growing further, breaking them up and reducing the amount of them. The other thing that can be quite helpful along with this is to use castor oil packs. You simply take flannel, whether it's cotton or it's wool. Wool is itchy, go cotton. Soak that in castor oil, wrap it around the knee, wrap some plastic around, wrap a heating pad around, and then a towel to insulate it. Sit back, relax, put it on low for a half an hour to 2 hours, depending on your tolerance. Remember, you've got metal in your knee, so be mindful of how you feel, and don't you don't want to cause any inflammation. Also, if you're not that far away from a surgery and you're still inflamed, you definitely want to consult your doctor or your physical therapist and ask them, can you apply heat at this time? When can you start applying heat? And after you do the castor oil pack, you want to do it every day. Then you want someone to get in there, massage it, stretch it, bend it, pull the tissues, stretch them. Anything that breaks up the scar tissue and stretches the natural tissues, because you possibly can regain the motion and break down the scar tissue. Also, if you have shortened tendons, by the way, castor oil pack is a miracle for that. Again, I had that. Yeah, what didn't I have? I was 12 years old, and due to the Juvenile Rheumatoid Arthritis, which loves to get creative and bend stuff and mess it up, it shortened my tendons in the back of my knees, and they were contracted at 90 degrees, right angles, and I could not stretch them out. They were talking surgery, they were doing traction, they wanted to do dial-lock braces, which that's basically like the medieval rack, and it can cause a lot of problems. It can break bones, it can rip up the back of your legs and cause scar tissue, which I had that happen. So if you can avoid that, it's better. So some diseases will cause contractures. Wearing high heels constantly and never walking on your flat feet can shorten your Achilles tendons, and then you're going to have trouble bending the foot up. There's many things that can cause a shortened tendon, so the remedy of choice really is a castor oil pack. My knees that were at a right angle, 90 degrees, in 1 month were completely straight and flexible. So it does work. It's a great thing. I would say in both situations, try it. What do you have to lose? Because you can always do surgery. And surgery is not the end of the world, but if you can prevent doing it, it's really in your better interest. And if you end up having to go the route of surgery, don't fret. Not the biggest deal in the world. I mean, it's better not to go through the anesthesia and all of that stuff. But when you wake up, I mean, they're doing this under anesthesia. You're not going to feel a thing. And when you wake up, you can move again. And it's definitely nothing compared to the joint replacement. The two ways that they usually go about breaking up scar tissue, one is, they're forcibly moving it under anesthesia and breaking up the tissues. If there's too much, then they do have to go in there, whether it's laparoscopically or just opening up and really getting in there and getting down to town, and removing all that scar tissue. But again, you're out. You're not awake for this, so it's all good. So I hope this helps you guys, and if you have any questions or comments, I'd love to hear from you. And hey, like I said, let my pain and suffering be your prevention. Happy to offer you the information. Thank you so much, and talk to you soon.